Hello and welcome everyone to Women's Health Tech Wednesdays. I am your host, Nina Joshi. And before I announce our guest for today, just wanted to run through a couple of quick announcements. We have New York City Health Innovation Week coming up in May. Make sure that you get your tickets for that. The QR code is available. And with that, would like to formally bring on our guest for today, Dr. Sindhu Pandit, who is really involved in global healthcare and life sciences at Salesforce. Welcome, Dr. Sindhu. Thanks so much for being here.
Oh, thank you so much for having me, Nina. Really, really excited to be here.
I am so excited to dive in and not only learn a little bit more about you, but also the amazing work that you're doing at Salesforce. And maybe, a great place to start the conversation would be if you could just share a little bit more with us about your background, your journey, kind of what led you to where you are right now.
How much time do we have? I've had a very bizarre, non-linear path, and the longer I do
I
this,
love this.
the more I find that a lot of my colleagues have had non-linear paths. I actually started in corporate America out of school. I was in marketing and finance and kind of climbing the proverbial corporate ladder, if you will, and then actually went to B school and I had an opportunity to do a pro bono consulting project for a hospital. And I found myself on kind of the side of the conversation that I had skills to sort of participate in the conversation on, but I really wanted to be on the other side. And so I pretty soon after decided to go to med school. And, I found PM&R, physical medicine and rehabilitation, as my specialty of choice. But really, it was the ability to connect with people and be a resource to them in a pretty in an ongoing manner. I wanted to be able to participate in an ongoing conversation, be a part of their journeys. And so I did that for some time. I was in academics, and then I took yet another career path change, pivot, if you will, into tech. And I did that intentionally because, again, I'd come from financial services, where
Mhm.
technology and data played a very, very critical role in how we approached our job, our conversations, our day to day. And this was a long time ago relative to where we are today. And then I come to medicine, and on the diagnostic and treatment side, we're hyper advanced. But then on the way the work was done, it was pretty archaic. And so I decided that I needed to kind of get an opportunity to participate in the macro level conversation and thinking about how the work is done, how care is delivered. And so, found my way in through Salesforce. And I've so much gratitude for that opportunity. But really, I consider it a continuum, not really chapters. It's really allowed me to gain skills and put tools in my toolbox along the way and be more, I guess, adept in having a variety of conversations horizontally, and by still practicing, allow me to stay vertical in certain areas as well.
That is incredible. What a career journey. And I think the way that you ended that is so powerful, and would love to dive in a little bit about how working in corporate America and finance, working as a physician, now working in tech. And I like that you kind of talked about it as like tools in your toolkit. For you, I'm so curious, how is that these different lenses that you have kind of positioned yourself with your current role right now at Salesforce, when you think about not just the conversations and the collaboration, but just innovation more broadly. Just so curious about that.
Oh, yeah. And, it's probably in three ways. One, I think it really helps to see how things are done in other areas.
Mm,
Um, I think being able to share experiences and share knowledge is sometimes undervalued. I
mhm.
really think we should kind of consider better ways to have a collaborative perspective on improving and kind of moving things forward under this umbrella of innovation that comes up a lot. Number two, I think it really allows me to connect to different people,
Mhm.
different parts of life. I really think about Again, when I'm at which work are we talking about, right? Like clinical allows me to really connect on a human level. And when I'm at Salesforce, I'm really thinking about the process level. And both are really, really, really have unique and important perspective. They're both important chess pieces to have, in the larger scope of kind of progress. And finally, I think, and I think sometimes this word is maybe, I don't know. I don't want to overuse it, but empathy. We've just been through a really tough time with the pandemic and such. And by putting yourself in different elements along the way, different types of industries, different types of roles, working with different types of individual, you develop an empathy muscle. And I think that is something that really allows me to be just allow me to think beyond the work that's being done, but kind of the progress that we're trying to make.
I love that. It's kind of like you're able to see what it's all kind of being done for and kind of that bigger picture, which I think is very incredible and definitely needed. And I think on that note, would maybe love to open it up and kind of pick your brain a little bit about, because you've been involved in these various industries, you've kind of seen how they intersect. In your kind of perspective, what are some of the pressing or present challenges that you're seeing as it affects healthcare, women's health, all of that more broadly within, I think, the current healthcare landscape, everything that's been going on. And also kind of curious to get your thoughts on the different kind of care models. I know you're kind of involved in like value-based care. I'm sure when you were in med school and kind of practicing as a physician in a different model. So also really curious to see how, different models of care play a role in some of these things too.
Yeah, I think what I'll say is this is a really big topic and it's changed a lot. I mean, the term VBC has been around forever. But I think when I think about the biggest challenges, the technology is great. Like it's awesome to see the advancement, right? My phone is now my peripheral brain. Like it is just how we operate, and technology is a part of our day-to-day life. Like it is so intertwined with how we operate.
Definitely.
What I will say, it's not about the technology in healthcare. You have to understand, not you, but we all have to understand the human condition. And the environment that we're operating in, kind of the other challenges that can affect our health on a day-to-day basis, really understanding kind of a holistic view of an individual is really how we're going to get to the other side of better outcomes. It's not the reimbursement model. And maybe that's not a very popular position to take. But I really think that we have all the tools we need, the technology that we need to elevate the care that we're delivering. I mean, advancements in science are incredible. And the technology is awesome, like what we're able to do. We just have to pull it all together with the right intention. So it's really not so much, I think, the challenge as much as it is getting out of our way and finding the right incentives to align the people that can kind of bring those solutions to the table, to the people that need it the most. And finding that, and whether we call it VBC or something else, that'll continue to evolve and change. But I think about it a lot like education. I think everyone should have access to it. I think it elevates our society when we have healthy people living well. I don't think that it's really something that is a nice to have. I think the more we have access to it and the more we can think about leveling that playing field, the better we'll all be. And that's not to sound like buzzy or anything like that. I just think that aligning incentives to that is hard. And that is where we need to focus, because the advancements in technology and science are happening. We just need to harness them for advancing the areas of these larger societal goals.
Yes. And I really like how you're articulating, I think, the need to form these bridges between things that are already kind of in place that maybe just need to connect to each other in a way that is sustainable. There's two things that you mentioned I really want to dig into. I think the first one is really thinking about holistic care and, really prioritizing patient-centered care. So I'd love if you could share a little bit more about, the work you are doing and kind of the work that you see that needs to be done to really continue to prioritize, patient-centered holistic care, whether that's in your practice or even the work that you're doing at Salesforce right now. Would love to have you share more on that.
No, it's really interesting. So when I came to Salesforce, I was only, minimally familiar with CRM as a technology, as a solution, so customer relationship management. And as I've been in this space, I kind of, when I explain to my colleagues and others, and when I'm given the opportunity to talk about my work, I ask people to drop the C and think about relationship management. And in medicine, when you're caring for people, you're caring for the individual, not their disease. Their disease is what they're living with, but you're trying to care for an individual. And we are sometimes challenged to do that at scale. And I think that's what the technology allows us to do. It opens the door for us to really support our patients as people. And to me, that allows all these other things that we talk about on the side, social determinants of health, health literacy, financial literacy, all these other components to sort of weave in to supporting individuals as they move towards not just managing disease, but living well. And that's the lens I take to it. So it's really not a one size fits all, because relationship management can be done in a number of different ways. Technology, I think, allows you agility that other ways, like, for example, I often kind of joke, but kind of it's real. My medical assistant had a binder that sat in our clinic, and it had all these notes about our patients, if they came with a caregiver, if they needed additional time to get into the clinic room, etc. And it was like our holy grail. Like, we went there to make sure I knew who I was seeing. That's not scalable, because that means if that individual left my clinic and went to another clinic, that information didn't travel with that person. And so I think that's what we need to think about in terms of all of these topics, all of these terms, is really, how do we support patients when they are patients, but remember that they are people.
I love that. And I like how you are talking about just relationship management in that kind of broader sense too. I think that makes so much sense. And it is really interesting to see how, to your point, we have a lot of the technology and the tools, but I think it's that sustainability and kind of continuing to have the interoperability depending on wherever you are as a patient. So I think that makes a lot of sense. And something else that you had mentioned, Dr. Sindhu, is really kind of speaking to the like overall wellness. And that kind of has me thinking a lot about like prevention and preventative care, and really thinking about wellness as kind of like an extension before almost healthcare. So would love to kind of learn more about your approach, kind of how you've been thinking about prevention, preventative care, within just your own practice, but also more broadly.
Yeah, I think this is, again, a huge component of that holistic care, right? Like, I think education about your own health and how to live well is a really big gap that we need to try to proactively fill. I don't think it's enough to kind of rely on the health system only to fill that gap, because we're just not structured in that way any longer. We've kind of evolved beyond going into only that, that clinic visit to get all your questions answered by the doctor that's been taking care of you for decades and knows kind of everything about you, right? Like, that is just such now it's like that's relegated to these old shows that come on, like, on these different channels, that I'm like, oh, I remember that time. But that's just not how things are done. So we need to think differently about how we're filling the literacy gap, the health literacy gap, for that, because it's easy for many of us to be able to check those boxes when we have insurance and resources to allow us to be ahead of the game, and also to receive that information proactively, saying you are due for X test. But broadly speaking, I think sometimes it's put aside as, again, something that we don't have to take into account right now, because I can do that later. And I think we really need to think about how do we make that forefront? Like, how do we bring that to the forefront of the conversation at a multitude of levels? So if you're in banking, thinking about not just your financial health, but allowing your financial, wherever you are taking care of your financial health, to remind you of some of the component, some of the tasks maybe, or some of the milestones that you need to meet with regards to your health. And in education, like ensuring that, as you're growing up in your schooling, that there's a component and a relevancy to talking about your anatomy, your physiology, and your overall health and what to look for up and down spectrum of age. And then as you're working, thinking about, are you staying healthy on a day-to-day basis? Not like eating well and exercising. That's important, obviously, and that's really critical, but your posture, your vision, your hearing, and staying on top of those things, saying, hey, this type of exposure can result in this. These are the preventative measures you need to have in place. Um, and I know that sounds like pie in the sky, but I really don't think it is. I think if
Mhm.
we all realize that this is something important to us, then we realize that it's probably something important to our team. And then if we just start there, then hopefully that'll continue to just change the culture of talking about health as a part of an everyday affair, as opposed to just when you're due for your wellness exam or when you're due for your, insurance renewal, et cetera. It should be a part of kind of the way you live and operate.
I love that. And it's funny that you mentioned kind of the old schools. I think about the physicians that you see in those TV shows that like make house calls, that like have known you since you were born. And it's just interesting to see how that is wholeheartedly not the case anymore. But a lot of these kind of practices were almost like built with that relationship style in mind. So I really like kind of the need to almost modernize how these conversations are having. And would love if you could share a little bit more because I'm just so curious. I like that you kind of mentioned integrating health conversations just in your life, and you had kind of talked about like in schooling, and I'm kind of curious because kind of thinking about maybe like younger people, like teenagers who are kind of now having these very maybe more complex health issues or just having kind of more curiosities around their health. Kind of really wanting to understand your take around like the role of patient education and maybe some of the things that you've seen, whether it's, approaches of meeting people where they're at, or how do we kind of update or modernize it beyond just like the 80s style pamphlet that's in a waiting room that people may or may not see.
Yeah.
Curious if you kind of thought through some of those things.
Oh gosh, this is my favorite topic. Like this,
Oh,
I could talk about this all day. I gosh, I come to, again, I think technology has such a strong role to play here because we can really think about like me as, my age and as a woman, as a person who works remotely, and you can kind of cater the message to me, Sindhu, as I operate in my life. You were talking about youth, like what kind of environment do they live in? Do they have a stable family, or are they going through challenges in their school environment? Is bullying prevalent in their environment? Should we be thinking about delivering messaging around that's passive and active, and go all the way up to 66% of caregivers are women. So when we're reaching out about women's health, are you also caring for others? So we're talking to you about women's health, but should we be talking to you about all of the other people that you're caring for in addition to your own health? I think it's being able to understand where that individual, whether it's a teenager going through, kind of your own physiological changes and dealing with that in the environment you're in, all the way up to a, perimenopausal woman, also caring for, her children and her parents. That's allowing, I think technology allows you to see people with all of their responsibilities, allowing them to be that individual managing these things, as opposed to identifying them as a population member. So it's important to think about the population to devise best practices, evidence-based care that's appropriate, but then using technology to allow you to get down to that individual and what is around their environment, but also what is the best way that they receive information. Because again, I have young people in my life, and some of them are social media experts, and that's how they
Mhm.
receive everything. But then there are others that are not.
Right.
And delivering piece of information to them along a certain platform would
Mhm.
miss them entirely.
Definitely.
So I think it's not so much thinking about these groups as everyone does this. It's saying, hey, this is a best practice, but then having the ability to cater down to the individual, and technology allows you that capability.
Definitely. And I like that even that you're really kind of honing in on even, even within these specific groups, they're not catch-alls, and really the importance of having multiple, like a multimedia approach where it isn't just solely social media or solely, pamphlets, that you're kind of really having a little bit of everything to make sure that you're catching everyone, which
It's
makes
it's interesting. I worked with the public health department not that long ago, volunteering for vaccines for during flu season, and I was really surprised the number of people who asked me for the paper with all of the information on it regarding all of the offerings. I was
yeah,
shocked because I like don't want to take any paper with me, but I
yeah.
was really kind of taken back by, and I'm glad we did. We had all of these like things, and I could write on there for them. But that was very much how this particular group at this gymnasium where we were having this event, that's how they wanted to receive their health information. And so I try to remember that, and they were fine. They had smartphones in their hands.
Yeah.
So in with regards to this particular type of information, they wanted something tangible and
Yeah.
that they could hold on to.
That's so interesting. It's funny that you say that because sometimes I realize I kind of do that too. And I don't really know why, but I think there's something about like your smartphone can sometimes feel like it's just a void of everything and you're going to forget versus having something to, I have no idea. Maybe, but that is so fascinating. Just the behavior around that. Huh. I'm so curious. I know we have a couple minutes left. So Dr. Singh, there's a couple things I really wanted to just pick your brain about. I think the first one is I'm just so curious as someone that has been involved in a lot of different industries that's now currently in tech. When you're having these conversations and pushing a lot of these initiatives forward, I'm just so curious, what are some of the things that, whether it's strategies or approaches or frameworks that you kind of personally use to really foster kind of that interdisciplinary collaboration that you were talking about earlier when it comes to all of these, various stakeholders with various motivations and priorities when it comes to, having these types of larger initiatives, kind of wanting to get your thoughts on what that looks like kind of in the weeds behind the hood of, working in this type of environment.
Yeah, this one's tough because I think in health, it's it's the most personal thing out there, right? We want to live well. And it
Yeah.
isn't something we want to turn around and talk about with everyone either. But
Mhm.
everyone will have a moment where they have to interface with the health system.
Right.
And everyone will have a moment where they're concerned about their loved one. It
Mhm.
becomes so personal so quickly. And
Yeah.
so when I hear things like, customer service and health, being a patient, to me, I decide when I'm calling in and I'm a customer or I'm a patient. That
Mhm.
resides with me, right? If I have something that is super concerning to me or I'm having an adverse reaction, um, I'm a patient in that moment, right? I want someone to approach me with kid gloves and talk to me and give me what I need in that moment. If I'm calling for parking instructions or other type of like logistical direction, like yeah, you
Right.
can put me with an AI chatbot, it'll be fine.
Yeah.
So I think when we back up to kind of thinking about kind of the strategy in a company that's supporting healthcare and life sciences, I think it's always reminding us all who are participating in these conversations about you can do well and do good at the same time, number one. And number two, we all sort of have a responsibility to up level the work people are doing in this space because we are all going to need them. And our
Mhm.
communities are really, really dependent on the healthcare institutions being present to support all of those that are in those spaces, whether it's rural, urban, whether it's highly advanced, not, whether it's, you have broadband or you don't. Either
Mhm.
way, we're all sort of in this together. And I know that sounds kind of lofty sometimes, but it's true. And so I
Yeah.
think the more we can bring this down to that level and remind one another we're all in this together. So, yes, I mean, there is an absolute need to do well because most of our companies are held to certain metrics that are in that capacity, and that's important. But
Mhm.
with the healthcare and life sciences space, there is a huge component of doing good. And I
Right.
think if we keep bringing that up and we keep more and more people that are at the table sort of intentionally thinking about that North Star, I think we'll continue to move the needle forward in the right direction.
That was incredibly powerful. And I really like how you kind of in the beginning talked about like that the choice is us, like we get to decide when we are patients. And when we decide that we are patients, we want to be, held to very specific expectations because it is so personal and sensitive and it is our world at that particular moment. So I think that was so incredibly just beautiful. Thank you so much, Dr. Sindhu. And I know we're kind of we have a few minutes, but I just wanted to quickly get to a question that we got. I think actually on this point a little bit from one of our participants that asks, "What is your opinion on AI nurses that NVIDIA hinted at?"
Yeah, I mean, again, I read about that and I saw it actually. I don't think it's AI nursing. I think again, it's sometimes these phrases sort of get intermingled. As I take away from it, I think it's really leveraging the power of AI, and it's not only NVIDIA, it's a
Mhm.
lot of companies playing in the space, but I think it's leveraging the power of AI to support um, questions and requests that come to clinical points because the data has always resided in that clinical encounter. And it's allowing the information to be surfaced up and downstream from that moment. So whether it's about, I have a particular dietary, like a specific diet, I have specific dietary instructions given my condition. Can I eat here?
Mm,
You
gotcha.
can leverage AI potentially to solve those questions in a much more efficient manner than leveraging a nurse
Right.
or another type of clinician, dietitian, doctor, whomever. Not because they can or cannot do that. It's again, we're limited with the human capacity that's serving these individuals. So how can we think intelligently about leveraging tools like AI to meet the individual with that question with the right information that is health adjacent, health
Mhm.
oriented, but perhaps can help that offload that work from
Right.
a nurse in their moment. And if we can't meet that question appropriately with that chatbot, ensure there's an off ramp and an on ramp
Definitely.
to get to that clinical person appropriately. And I hope that's how all the companies are designing their solutions in
Mhm.
this space, on ramps, off ramps, and ensuring tight feedback loops because we can go into the world of offering advice that isn't probably appropriate for a chatbot quickly. So we need to
Mhm.
make sure we keep our eyes on where we're headed with these tools.
That's very, very good point around like having escalation points and having ways that you can kind of opt out of. I think that is brilliant. We are at time. Time just flew by. We definitely need to have you back, Dr. Sindhu, for a part two of this conversation. It has been so much fun, picking your brain and learning from you. Really appreciate you taking the time to chat with us.
Oh, what a pleasure it's been. Thank you so much for having me. And I do look forward to being back with you all.
Absolutely. Thank you so much, Dr. Sindhu.